Discussing the health problems, particularly the public health problems that have been getting worse, and these are inequalities, obesity, alcohol-related harm, loss in mental health, depression, anxiety, loss of well-being, growth in sexually transmitted infection, and along with obesity is rising rates of things like diabetes. And what I've been arguing is that these problems are distinctive because they affect, to a degree, all parts of the population. So if we consider the problem of obesity, obesity arises in a population like Scotland's because everyone is slowly putting on weight, typically on average about a kilogram a year. So if everyone's increasing their weight by about a kilogram a year, then the number of people who fall into the overweight and obese categories increases year on year. The corollary of this, of course, is that if we've to stop the obesity epidemic, we need to cause the whole graph to move back towards the left so that everyone starts losing weight or at least stops gaining weight. So the problem is not that of the obese or even of the overweight, but of the whole population and the imbalance in calories. And a kilogram a year can be put on by simply having, on average, about 35 to 40 extra calories a day, less than one digestive biscuit. So that small imbalance across the whole population shifts everyone towards the higher weight. Equally so, if you think about mental health, and a rise in the sort of levels of stress, the sense of which people are in over their heads at work, shifts everyone and thus multiplies the number of people with depression and anxiety. The same kind of argument can be argued with respect to alcohol, where the median level of consumption drives the number of people in the problem drinking and cirrhosis categories. So the thesis in general is that we have a set of problems which are becoming more prevalent because of the late effects of modernity. People are reacting to living in their circumstances in various ways, and we see this manifested in these modern day diseases as opposed to diseases. And I would also suggest that mental health, the sense of well-being, is central to this whole process, and the loss of well-being, the loss of purpose and meaning may be driving others, and it may be a strategic issue to address as a way to helping these other problems.